Awesome. Well, thank you all for being here today to join us and the Food Bank of Iowa to talk about food insecurity. One of the parts of One Iowa programming is actually talking about the aging LGBTQ population. And so this piece of programming is part of that larger initiative because we know that food insecurity is extremely multifaceted, especially right now during COVID-19 as it kind of grips our nation and our state. Food insecurity also disproportionately impacts LGBTQ folks and older and aging adults. So we are really excited to hear a little bit from our speaker today. Michelle Book is going to be giving us a presentation on food insecurity here in the state of Iowa. And then we're going to have the opportunity to have you ask some questions if you have some. I have some questions as well that I'm excited to ask and kind of tap into this wealth of knowledge that we have. But I would love to introduce Michelle. Michelle began her role as president and CEO of the Food Bank of Iowa on February 1st in 2016. The Food Bank of Iowa is a Feeding America member, which helps to feed 175,000 food insecure Iowans in 55 Iowa counties via 625 smaller frontline partner agencies, which include schools, pantries, homeless shelters, and other organizations. The Food Bank of Iowa acquires over 1 million pounds of free and reduced cost food each month, keeps it safe for consumption, and delivers it to local organizations who feed the hungry. Now, of course, prior to her work at the Food Bank of Iowa, Michelle led a global community engagement for DuPont Pioneer and served as the president of Pioneer International Foundation, which contributed $6 million annually. She was responsible for the worldwide philanthropic giving and community betterment, focusing on food insecurity, science education, and community betterment. Prior to her time at Pioneer, Michelle served as a global compliance manager for John Deere Finance. She created and implemented the Sarbanes-Oxley protocol for John Deere Finance worldwide. John Deere assignments took her to numerous international locations for lengthy visions, which honed her appreciation for different cultures and diverse perspectives. Michelle serves on the following local community boards and councils: the U.S. Bank Advisory Council, Brenton Arboretum, Salisbury House, and Mid-Iowa Council of Boy Scouts. She is also the member of the Des Moines Noon Rotary and Nexus Executive Women's Alliance. In the past, she has served as a board chair for Bravo Greater Des Moines, board chair of Des Moines Botanical Garden, a member of the Governor's STEM Advisory Council, and an advisor to Smithsonian National Museum of American History. Michelle was honored to be recognized as a Des Moines Woman of Influence in 2014. Michelle is originally from Jefferson, Iowa, and resides currently in Des Moines, Iowa. She holds a Bachelor of Business Administration degree from Iowa State University. She's a certified public accountant and certified internal auditor. Her career has spanned opportunities in hog farming, healthcare, international business, and nonprofit leadership. In her free time, she enjoys sharing great food with interesting people, relaxing with yoga, and recreating in nature. Thank you so much, Michelle, for being a part of today's program. We're so excited to hear from you. You clearly have so much knowledge and an incredible background to share with us. I'm so excited to hear more from you. So with that being said, I'm going to hand it over to you.
Thank you. It's an honor to be asked to speak to this group today. I was very excited about the opportunity. We're going to talk a little bit today about food insecurity. What is food insecurity? What's a food bank? What role do we play in solving the food insecurity issue? And then some lessons learned through this COVID experience. And then a little bit about what food insecurity looks like for the LGBTQ community. So with that, I'm going to share my screen, I believe. And my slideshow from the beginning. Okay, do you see food insecurity amidst COVID-19? Yes? Oh, I love it when it works. This is fabulous. So just a little bit about food insecurity. And food insecurity is the lack of enough food consistently to lead a healthy life. The numbers in the United States are staggering. And I'll tell you, this data is from an older study, Feeding in America, 2014 Hunger in American study. There is quite a bit of information out there recently. There's a Northwestern Institute for Policy Research paper that just recently came out saying food insecurity today is about 2.5 times. These numbers are old, and these numbers are low compared to where we are today. Hunger is defined as an individual situation, and it's the uneasy or painful sensation caused by lack of food. Food insecurity is a much broader term, which refers to the household and the coping mechanisms when households have to find ways to avoid hunger. And food insecurity exists whenever the availability of nutritionally adequate and safe foods, or the ability to acquire these foods in socially acceptable ways, is limited or uncertain. This is the Food Insecure Iowan, and again, this is older demographic data, but what I'd like you to take away from this slide is that people who are food insecure in Iowa, it's as true during COVID as it was before, most of the people look a lot like you and me. They live in a house or an apartment, they have a roof over their heads, they have an education, at least a high school diploma, and most of them are working jobs, 1 or 2 part-time jobs, but just can't piece together enough income to make sure that all of their basic needs are solved. I was meeting with a healthcare professional some time ago, and he made the comment to me that food insecure people don't need more food. He said, those people don't need more food, they're all overweight. Well, people who live in poverty suffer from something called food insecurity. And with food insecurity, folks will use their dollars to acquire as much food as possible, and that means carb-rich, calorie-dense foods. And of course, if you and I lived off of ramen noodles, we would be a size or 2 bigger. So it's very common that people that live within this space of food insecurity and suffer from food anxiety are obese. Almost 1/3 of the people who live in poverty and are food insecure suffer from obesity. And of course, obesity leads to some very problematic health issues, heart disease, high blood pressure, diabetes. And all of these things cost each one of us more money because of healthcare costs. My biggest concern is for the children. And we do know from several studies that children who grow up in a food insecure household suffer significantly. And the suffering is not just in time, but how they learn to eat, how they learn to cope. The emotional distress stays with these children for their entire lives. It leads to health issues such as heart disease, diabetes, and also leaves lifelong scars and creates problems with their mental health in adulthood. So how did we get to this place where so many people are food insecure? And this slide, I think, is very, very interesting. Back post-World War II, many people realized economic growth. So the people that were in the top 5% of our economic strata and the people at the bottom 20% of our economic strata between 1947 and 1975 had income growth that was pretty equal. Of course, income growth when you have a higher salary it's more money. But both these groups, their positions were improving at about the same rate. And then when you go about the time that I'm going into high school, 1975 and later, the top 5% things slowed down for them, but still pretty good income growth. Those at the bottom 20% of our economic ladder, it slowed to almost a squeak. And then post-recession, 2009, 2012, really up through 2019. The top 1% of Americans, those that are many refer to as the meritocracy, saw income growth of 95%, while the folks really at the 20% of our economic status saw no income growth whatsoever. I think this is shocking. And again, this is pre-COVID, that half of the American families have an annual income of less than $60,000. It's absolutely shocking. So as we are thinking about food insecurity, we know that the food banks play a big role in solving the problem. And I'd like to talk just a little bit about the role of food banking. Food banking started in the 1960s when a retired businessman in Phoenix, Arizona, was volunteering at a soup kitchen and talking to the people that came through the line as he served them. He realized that many of these people, when they weren't eating there, that they were pulling food out of a dumpster behind the grocery store down the street. He saw people going hungry while perfectly good, edible food, but unsellable food went into landfills, and he created the food bank concept to solve two big societal issues. Today, there are 200 food banks across the United States which operate under the Feeding America umbrella. And this network exists to help families across the United States put food on their tables when times are tough. As a Feeding America food bank, Food Bank of Iowa, and our partners must strictly adhere to food safety guidelines, and we're committed to serving those in need. Folks struggling to make ends meet are assured Food Bank of Iowa and our partners will provide food which is safe to eat, nutritious, and served with kindness. Families, my family, your neighbor's family should never have to worry about how they're going to put food on the table. So what is a food bank? Many people don't know the difference between a food bank and a food pantry. And 5 years ago, when I was working in corporate America before I came to the Food Bank of Iowa, I did not know the difference. On the left, you see an image from the Food Bank of Iowa from our 55,000 square foot distribution center in Des Moines. At the food bank, food is acquired in semi-truck quantities. It's stored in case lots by the pallet. And these pallets are racked, as you can see, all the way to the roof. Our freezers and our coolers are huge, again, with racking all the way to the roof. We use forklifts and pallet jacks to move pallets of food around our distribution centers. Then on the right, you see a typical food pantry. It looks a lot like a small town grocery store. Food pantries and our partners that run them, they order food from the food bank by the case and display individual food items on retail shelving and in retail style coolers and freezers. Generally, clients are invited to come in and shop. However, today, many pantries are preparing boxes to hand to the clientele curbside. Because of my business background, I think of the food bank as a wholesaler and the Pantry as a retailer. There are 6 Feeding America food banks that work across Iowa, all of which work together to make sure every Iowan is getting the food they need. Food Bank of Iowa is the largest of the 6. We cover 55 counties from 2 locations. We have a distribution center in our main office in Des Moines, Iowa, and another distribution center in Ottumwa. Combined, Food Bank of Iowa has over 90,000 square foot of well-lit, highly organized, safe food storage space. Food banks are responsible for finding and procuring free and reduced cost food. We have to keep it safe and then get it to our smaller frontline partner agencies. Both distribution centers for the Food Bank of Iowa maintain an inventory which includes milk, eggs, meat, produce, and shelf-stable items such as peanut butter, spaghetti, pasta sauce, cereal, canned tuna. Our partners order food from our online order entry system. Orders are picked from the inventory, they're placed on pallets and shrink wrapped for delivery. Shelf-stable, cold, and frozen foods are all transported safely in temperature-controlled vehicles. Food safety is of paramount concern. We operate a fleet of 9 refrigerated box trucks and 2 refrigerated vans, and we hope to add a semi-tractor trailer or 2 to our fleet very soon to help meet the expanded need due to COVID. Speaking of COVID, COVID has brought many challenges to all of us. The contagious nature of COVID and the rapid economic shutdown presented significant challenges for the Food Bank of Iowa. Suddenly the need exploded as children who are used to getting 2 to 3 meals every day at school were sent home. College students were made to leave the universities. They came home and added to the family food budget stress. Senior citizens were suddenly afraid and isolated. And then so many people started to lose hours of work and their entire jobs in many cases. At Food Bank of Iowa, we could not distribute food working from our home, and we needed volunteers to help us meet the expanded need by packing emergency food boxes. Safety measures were devised within days to protect employees, volunteers, partners, and our clients. And at a time when we needed more food, our retail store donations shrank, decreased by 50%, as more of us ate at home and grocery stores saw less waste. We had to find more food to fill twice the need and a way to deliver it across our 30,000 square mile geography. And we had to invent all over again, all the processes so we could be effective and efficient in a completely new environment. Early on, one of our biggest challenges was a consistent labor force, because so much of the food that we distribute is donated food. We need volunteers to come in and check that food, make sure that it is still good to serve, sort that food, sometimes repack that food. Corporate volunteer groups canceled immediately. And of course, groups were limited to 10 people or less. Our team quickly revamped our volunteer center to accommodate more stringent safety and sanitary measures and social distancing. Duct tape is a wonderful thing. Our floor in the volunteer center is now covered with different colors of duct tape. We sent out a plea for help immediately, and people responded. In the first month or 2 of COVID, our volunteer system crashed often because so many people were coming into our system to volunteer. In fact, in March, April, and May, we saw almost a 20% increase in our volunteerism from the prior year. People wanted to help, they wanted a purpose, they wanted something to do. We also found ways for people to volunteer from home, making face masks t-shirt tote bags, and notes of inspiration to include in our food boxes. We shifted our distribution model from in the pantry shopping to drive-through distribution models to provide safer, low to no touch delivery to those in need. This took up more space on our trucks because the food had to be pre-packed. It added costs for bags and boxes and required more labor on the front end to pack the food. We also added many new partners. One of the silver linings from COVID, and the thing that's been the most encouraging, are the people that have contacted us that want to help. They have resources, they have people, they have distribution centers, ways to get the food out. We're working more closely with veterans organizations, with Area Agency on Aging, and many, many influential church groups to get more food to the newly needy. Something I never ever dreamed I would do in my career was to write a National Guard mission. Yet a couple of months ago on a Sunday afternoon, I was sitting home doing just that. Knowing transportation would be a pinch point for Food Bank of Iowa, I immediately requested Iowa National Guard support from Governor Reynolds. And that support was granted at the end of April and will continue through August. National Guard soldiers and trucks are delivering shelf-stable food for parking lot distributions across the state, and they're staying there to hand out the food to food insecure Iowans. They're running more than 30 distributions each month. They ran 35 delivery and food distributions in May alone. And yes, on the left, that is Senator Grassley. It's hard to tell who people are behind the masks, but he does have an American flag mask, and he was in Pocahontas to help us distribute food to the people there that were going through the parking lot distribution. Well, my computer, oh, there it is. There it goes. It was not letting me forward. So people often ask me, where do you get this food? Where do you get the food that you distribute? Our job at Food Bank of Iowa is to find as much free and reduced cost food as possible. We keep it safe, and we deliver it to over 600 smaller frontline partner agencies quickly. So these partner agencies could be traditional food pantries in church basements. More likely now, it's a food pantry in a school. We have over 100 school pantries across our geography. Homeless shelters, daycares, feeding sites, halfway houses, after-school programs. The partners come into our electronic order entry system and post their order. Prior to COVID-19, half of our food was donated food. We would get donated food from retail partners like Hy-Vee, Fairway, Walmart, Target, Aldi, and wholesale partners like Tyson and Barilla, Pasta, Smithfield. About 30% of our food came from the USDA and came from the USDA commodity food programs. And 20% of it was purchased, and a lot of that was school backpack supplies and food that went to school pantries. Well, our world changed very quickly with COVID, and the donated food dropped off because many of our partners were grocery stores, and the food was being purchased by us and used more efficiently by us at home. So donations went down, but at the same time, the USDA implemented several new feeding programs through their commodity food programs. And that food came to Feeding America food banks, and it was our job to distribute it to people in need. And with the additional food from the USDA, we have found ourselves purchasing less. Also, our backpack program right now has been, some of it's been put on hold. So our comparison of March to June last year, which you see at the bottom, compared to March to June this year, which you see on top, is staggering, really. 4 years ago, when I came to the Food Bank of Iowa, we distributed about 800,000 pounds of food a month. Last year and prior to COVID, we were distributing about 1 million pounds of food a month. June was our biggest distribution month on record, as we distributed nearly 2 million pounds of food. Truck routes. All this food has to get out the door, and it has to get to partner agencies. You can see that we've had a huge increase in the number of truck routes. Our biggest challenge has been trucking, with food being transported in pre-packed boxes rather than by the case. More trucking capacity is required for the same number of pounds. And with increased pounds, trucks have been further stressed. We also know that we have 2.5 times the need that we had just 6 months ago. During the initial months of COVID, Dahl Distributing, who distributes Budweiser beer, they found themselves not quite so busy distributing beer, so they loaned us a semi and a driver. The semi was a refrigerated semi unit, and they really helped us. They drove every day for us, getting the food to the furthest reaches of our geographic area. And so we had some experience with the semi. We know it's incredibly effective. So we are hoping in the next fiscal year to acquire 1 or 2 semis that will just help us move more food more effectively. We don't have data back from our agency partners yet with June, but just looking at March, April, May this year compared to last year, you can see that we have served a significantly higher number of people within the COVID environment than we had before. Food insecurity is not a new problem. Before COVID, 11% of all Iowans lived at or below the poverty line, and there were 175,000 Iowans deemed to be in need of food assistance across our geographic area, which you see in orange on the screen. At that time, Iowa unemployment was below 2%. So let me repeat that. 11% of all Iowans, more than 1 in 10 Iowans, lived at or below poverty. They suffered from food insecurity, and that was when unemployment was 1.7%. At that time, I guess it was November of 2019, Go Bank Rates Savings Survey reported, and this is November of 2019, that 70% of all Americans had less than $1,000 stashed away, and 45% of us had no savings whatsoever. Our society was not prepared for the economic destruction of COVID, and we've been precariously perched for years. We were certainly not financially prepared for the measures that our government took to protect vulnerable and older Iowans and Americans from illness. Now our state unemployment number is in double digits. In many counties, we're serving 2.5 times the number of people we served before. And Feeding America and McKinsey Consulting is telling us that this greater need, 2.5 times what we were serving just this last January, we should be expected to solve that need, to work towards solving that need through December of 2021 at the earliest. Recovery is going to be slow for many, many, many people, especially for those who have existed at the bottom half of our socioeconomic ladder before COVID. Food Bank of Iowa is preparing for the long haul. Regardless of socioeconomic status, all of us in recent months have suffered from scarcity and fear. I believe this has expanded our capacity for compassion for those who live in this space all of the time because of poverty and food insecurity. It's my belief that Iowans will continue to help fellow Iowans through COVID and hopefully after COVID. I'd like to share just a few statistics about food insecurity and the LGBT community. The LGBT community faces hunger at rates higher than the population as a whole. As many as 20% of the LGBT community may have trouble affording enough food, according to the Williams Institute at UCLA. Up to 2.2 million LGBT Americans face food insecurity every day. More than 25% LGBT adults aged 18 to 44 get food stamps, compared to 20% of that same age group, non-LGBT. And food insecurity disproportionately affects certain groups of people, including those living in poverty, people who are under or unemployed, and the homeless. Transgender and gender nonconforming people are a diverse group who experience some of the highest risk of food insecurity. I will come back to Max. Are you gathering questions? Are there any questions out there for me? This is a lot of information.
Yeah, it's a lot of really great information. I have not seen a specific question in the chat yet, but I do have a couple to get us started. I have so many awesome questions, partially because your talking points today were so interesting to me. A lot of things that I didn't know that I was learning from. It looks like what we're gonna go ahead and do is as people add questions in the chat, they can also raise their hand and ask a question by being unmuted as well. So if you want to ask a question in person, you could do that. But we actually have a first question here from Terry. Thank you so much, Terry. So what is the greatest need for the food bank right now? And she also says, excellent presentation.
Thank you very much. I'm getting used to this Zoom thing. I'm a people person. Mm-hmm. So I love to be in the room. I love to tell stories. I like to ask people about their experience. And over Zoom, this is really challenging. It's just because I just don't get to see your faces. So thank you. You've been very patient with me. Our greatest need right now, continues to be funding. Because we do know, I know this is going to be a long haul. The community has been generous. The business community and individuals have been generous. We're seeing just a lot more cost with transportation and the things that it takes just to keep everybody running here. The sanitary materials, face masks, gloves, aprons, boxes, bags. So those all continue to cost, and just gasoline and tires for more miles on the road. The other thing that I always say is of greatest need is advocacy and awareness. So this is a very influential group of people. You are out in the community in a lot of different places. Talk about food insecurity. People are more aware of it now because all of us have gone to the grocery store and been frustrated. All of us know somebody today who have lost their job through no fault of their own because of COVID. It happens every day. It happened before COVID. But if you can help spread that compassion, tell that story, talk about food insecurity, that would be extremely helpful. And then if you know people that need help, please point them toward our website. If they put in their key in their zip code, they'll find one of our partners near them where they can go and get help. So I'm telling people, if you need help, please get help. Now is the time to get help. Save your money for your car payment, for your rent payment, for your utility payment. Let us help you with food. If you can help, come to our website as well. It's www.foodbankiowa.org. Give us an hour or two of your time. Give us $1 or $2 if you're still employed. Thank you.
Awesome. That's really helpful information. I know everyone right now wants to do their part in helping. It's a really amazing thing to see. But yeah, thank you so much. Again, if you have any questions, please feel free to pop them in the chat and we'll go from there. But I do have a couple of questions for you. So the first is, I'm curious about how the Food Bank of Iowa has worked to be a more inclusive environment for LGBTQ folks experiencing hunger. So what does that look like for you all in terms of being inclusive?
Well, we continue to look for new partners, and I've been heartened by the folks that have stepped forward, that have said, I know that there are people suffering in my community and our community, and can we help distribute food? So we have a lot of new partnerships in place. One of the things we do to be inclusive, there is a need across our network to gather data. So in some cases, we aspire to make sure people are handed food with dignity. We do ask for a small amount of information from people. Their zip code, we need that for the USDA food, the ages of people in their household and the number of people in their household. But we don't ask a lot of questions other than that. We want people to come to the food distributions knowing that regardless of their background, how or why they're here and they're food insecure, that they'll be given food along with grace and dignity. And so we are open to everybody. We don't ask. Many of our partners, a few do, but many of our partners don't ask for IDs legally. To distribute USDA food or to give USDA food, they can't require that you have an ID. So if you're out there and somebody requires you show an ID, call me, because the federal government does not allow that to happen. But we do intend that everybody be served with dignity.
Absolutely. I think you've brought up something that's really important in that you don't have to show an ID to access these services. And I think that's so important because one thing a lot of people don't realize is about 80% of transgender Iowans haven't been able to change or update their government identity documents, including their driver's license or a state issued ID. And so it makes it really difficult and puts them at additional risk because their name, the name that they go by, might be different on their driver's license. So just to have that peace of mind that you're not going to be questioned about your name or things like that as you're picking up those much needed items, that's a great thing to know about. That's really important.
That's a great thing for me to know. I didn't know that 80% had problems getting an ID. Thank you. That's excellent information for me to have. We also have a person on our staff whose sole responsibility is to attend food distributions and sign people up for SNAP, Supplemental Nutrition Assistance Program, formerly known as food stamps. And she is LGBT. She's also African American, and she's fierce. She makes sure everybody is taken care of, and she helps to get people the resources that they need. And she is just, she's a miracle in and of herself. So she is out there working and identifying people that have a need and helping them work through getting the help that they need.
Awesome. Yeah, and knowing about those folks that can assist in that process that's so useful to know about as well. And I think sometimes we forget that there are point people that can be helpful in accessing resources too. So that's great. Yeah, and I think this is just one of those moments when it's that intersection of socioeconomic status and LGBTQ, like being LGBTQ intersects really in an interesting way, because again, if you don't know about the state of gender, what it means to change your gender marker or your name on your IDs, you might not necessarily think of how that might be a barrier to accessing service. So it's just one of those moments when that intersectionality is really key to understanding those barriers for sure. So yeah,
Thank you for that.
Yeah, absolutely. So this next question is, if somebody in the LGBTQ community is facing food insecurity, how can they get access to food from the Food Bank of Iowa? What are their first steps of action?
So I would say first and foremost, go to our website, and there are two buttons on the website on the front page. One is Need Help, and the other is Give Help. So I would say go to the I Need Help button. It will ask for your zip code, and it will pop up several of the pantries that are closest to you. And I would suggest that before you take off in your car or have a friend help you get there or get on the bus, that you call first, because hours are changing. There's so much changing with COVID, but make a phone call first. We do have several people that come directly to the food bank. Again, the food bank is a wholesaler. We are finding all this food and getting it to our partners. So typically, we don't have open hours where people come in and shop at the food bank to get the food they need. But we do take care of people. So folks that arrive here at the food bank, we will give them an emergency food box. We will give them information to help them sign up for Supplemental Nutrition Assistance Program, SNAP benefits, and we'll give them a list of the pantries that are in their area. So you can come out to the food bank and we'll help you, or I would say get on the internet, www.foodbankiowa.org, and we'll make sure that you get some help. On our website also lists telephone numbers. If you can't go out, people are homebound right now. They might be homebound because they're ill. They might be homebound because they don't want to be ill. But many people are homebound right now. So there is a phone number on our website. If you need help and you need food to be delivered to you, we'll make sure that happens as well.
Awesome. That is actually a really great point. I think a lot of people have some misunderstandings about how to access food, and think that you can maybe just stop by one of y'all's offices to access food. But it's great to know that you don't leave people without if they do that. But that's awesome to know that you'd want to get connected with a partner organization as well.
Well, long term, if the need continues for more than a week or two, you'll want that partner organization's support. You'll want to have the SNAP, the food stamps, apply for those to make sure that you have those at your disposal. And this month, during the month of July, people that are unemployed, they were seeing an extra $600 per week in their unemployment check, and that's stopping during the month of July. Meanwhile, SNAP benefits, the federal government has ordered that SNAP benefits be distributed at the highest level possible for the number of people in your family. So it is worthwhile to sign up for SNAP benefits for food stamps. Very easy to use them in the grocery store. You use an EBT card, and it's loaded every month, and it's very easy to use those benefits. So I do encourage people to pursue that.
Sounds good. Well, that's great. That's very helpful information to have. And yeah, thinking about the need being longer term as opposed to that shorter term, and those benefits you can receive. We do have a question from Cassidy. So I think Cassidy can unmute themselves and ask their question, and I'll go ahead and let them do that.
Hi, can you hear me?
Yes.
Hi, Michelle. So I actually have like a more of a numbers question, which seems like you're probably the best person to ask. When it comes to people of color who are already disproportionately affected by food insecurity, and then you add that intersection of LGBTQ plus, is that when do the numbers then almost like double food insecurity, or is that not exactly how it works?
Oh, no, that's pretty much exactly how it works, Cassidy. Food insecurity is disproportionately higher for racial and ethnic minorities, especially within the LGBTQ community. It's disproportionately higher for women compared to men within the LGBT community. And I would say, what numbers do I have in front of me? 42% of African Americans and 33% of Hispanics were food insecure in the past year. In contrast, and that's the LGBTQ community, in contrast with straight African Americans at 28%. So 42 within the LGBTQ community, 28% straight community for African American, and then Hispanics, 33% LGBTQ community compared to 24% for straight Hispanics. Among adults, LGBTQ community, 31% women went food insecure this past year relative to 22% men. So we do know women are hit harder and ethnic minority groups are hit harder.
Wow, thank you so much for clearing that up for me.
Yeah, those are scary numbers, and I just, we've got to do better. We can do better. I know we can do better, and we just have to do better. When I go out and I meet with our partner agencies, and I'm out at the mobile distributions, and I'm meeting with these individuals, and the stories they take my breath away. One woman I'll tell you about, she had 5 little boys with her, and holding one, a brand new baby. And I love babies. It's like, give me the baby. But she had, and they're all boys, five little boys. The youngest brand new baby, and the oldest maybe 11, 12. And she was very, very patiently waiting in line. She waited for a long time, and I went up to her and I said, I'm so sorry that this is taking so long. I said, your boys are so wonderful, so well behaved. And she said, they're hungry. And they know that after we get through this line, I promised them they can have something to eat. And she went on to tell me that she works at a convenience store, but they don't allow her to come back to work until the baby is 6 weeks old. Her husband she said, my husband has a great job, a good job. He works construction and he builds highways. But she said, I just can't keep enough food in the house to feed these boys. My paycheck pays for our groceries. And she said, I just need a little help for a couple of more weeks, and I'm going to go back to work, and I know this is going to be okay, but these boys are hungry. These are hard-working people that really want to take care of their families. But when you think about essential workers, the people that check you out at the grocery store or the hardware store, the people that clean your house, clean hotel rooms, the folks that take care of you at the hospital or the retirement home, the essential workers, they're not making a living wage. They're not making enough to make ends meet. How do we get these people, because they're valuable and we need them? Sometimes it's teachers, it's soldiers, the people that protect us. How do we pay them enough that they can live? I really think that that is the political quandary that is before us right now. All these inequities, if you're not white, middle-aged, if you're not that, then you're suffering. You're not getting what you need. And we have to find a way for this to go away. I want to retire. I don't want to be feeding people. I think it's crazy that we have a secondary structure in place, that food banks go out and find free and reduced cost food that the grocery stores and everything no longer think they can sell. We take it from them, and then we get it out to people that are food insecure. Why can't we all just go to Fairway and get what we need? That's my perfect world.
I think you've hit on something that's really important here. I think you've talked a little bit about food rescue, which is what you're talking about with utilizing those grocery chains and kind of breaking the chain of that food going to waste when it doesn't need to. Is that work that you're already doing?
Mm-hmm. Food banking was started, as I said earlier, in the 1960s,
mm-hmm.
based on food rescue. And there are many Feeding America food banks today that don't purchase anything. They have no budget. We have a budget for purchasing staples like peanut butter, spaghetti sauce, canned meats, canned fruits and vegetables if we don't get them from the USDA. But there are a lot of them that do it solely off of food rescue. But when you work with a Feeding America food bank, we are subject to very strict food safety standards. So whatever the restaurant down the street and the grocery store down the street, whatever they have to comply with, we have to comply with. Make sure you're working with an organization that's affiliated with a Feeding America food bank, because if not, you don't know if that food was kept safe. You don't know if those gallons of milk that were rescued from the convenience store, if they're rolling around in the back of somebody's trunk. You don't know if that lunch meat that's been repackaged from bulk down into family-sized packages, you don't know if the people that repackaged that were wearing hairnets or even a full shirt to cover their arm hair. You don't know. So and right now, a lot of people are giving away food on the corners. Restaurants, grocery stores, people are just giving food away. That it scares me. People that live in this space of food insecurity are already compromised. Their immunosystems are already compromised because they struggle in so many ways. Giving them food which is not safe to eat is a travesty. Mm-hmm. We just can't. So make sure you're working with people who are rescuing food in a responsible way, keeping it safe, keeping it proper temperatures, and getting it to people that need it most. We work with Hy-Vee, Fairway, Walmart is excellent. Aldi is a great partner. Target is a great partner. And we have processes in place where we rescue from them regularly, same time every week, using coolers, freezer blankets, refrigerated trucks and vans. Food safety is critically important.
I think that you have pointed out something that I don't think very many people think about, which is that, on its face, it looks like, well, of course we do food rescue. We don't want things to go to waste. So by any means necessary, let's utilize that food. But I think you have brought in, I think, something that's really important, especially when we talk about donations of any kind, which is that, the folks that utilize your services and your work, they deserve food that is safe, and they deserve like high quality donations and things like that. And so I think a lot of people don't always think about that. They think about like quantity or whatever is available. And so I think you've really shown a light on something that's really important, which is that it's not just enough to have that food. We want to make sure that it's safe and healthy and high quality. So thank you for pointing that out. I think that's something really important.
And within the Feeding America network, we're required to make sure that food goes to people that aren't in need. So we need to be with that food, stay in contact with that food to make sure it's going to people that have an economic need to receive that food. And in return, we give paperwork to the retail and the wholesale donors. They get to take a pretty significant tax deduction because that food is going into an environment where it's helping food insecure Americans. And if we can't validate that, then the tax benefits they're getting are not valid.
Certainly, that makes a lot of sense. Well, thank you so much for letting us peer into your world a little bit and learn so much about food insecurity here in the state of Iowa, and as it relates to COVID, the LGBTQ community, and of course, aging and older adults. I do want to mention too, somebody left a really lovely message here. Michelle, thank you so much for your powerful and impassioned call to action. And you are so right. We should be aware enough, taking action and making choices to support the vision that you outlined. And I have to agree with Barbara on that one.
That was kind. Thank you.
Absolutely. Thank you so much for being with us today, for giving us your time and your expertise and your insight. I really appreciate having you. This was just a treat. So thank you so much.
Thank you for asking, Max. And if I can do anything to help anybody in your group, in your network, please reach out.
Absolutely.
Please, we have lots of resources here, and we're happy to help. Thank you.
Sounds good. Thank you so much.
Yeah.
I hope you all have a good evening and try to stay dry out there. Maybe it won't rain. Who can know? But yes, thank you so much.
Be well.
All right, you too.